in the legislature.
Thanks for watching TMA's Legislative Hotline for Friday, March 15th. I'm Brent Anier. Up this week, a key step forward in the state budget, examining the cost of family planning funding cuts, and first, from healthcare teams to cutting red tape to immunizations, the Texas Senate was busy passing several important TMA-backed bills this week. The upper chamber unanimously passed Senate Bill 406 by Senator Jane Nelson. The bill upholds the physician-led medical team and makes it easier for doctors, advanced practice nurses, and physician assistants to work together to care for patients. For months, TMA worked with those two groups and the Texas Academy of Family Physicians to craft the agreement. Representative Lois Kolkhorst filed the bill's companion in the House. The Senate also passed one of TMA's red tape reduction bills, Senate Bill 166, by TMA physician member Senator Robert Deuel. The bill allows physicians and their staff to check in patients using the electronic strip on the back of their Texas driver's license. Doing so would reduce the amount of paperwork patients have to fill out and medical staffs have to transcribe. And the Senate passed two important immunization bills by Senator Nelson that would protect children. Senate Bill 63 would allow a minor who is a parent or is pregnant to consent to his or her own immunizations. Currently, most minors in this situation need their parents' consent to get vaccinated, even though they can consent to their baby's shots themselves. Senate Bill 64 would require licensed child care facilities to implement an immunization policy for their employees who care for the children. The idea is to protect the children from exposure to vaccine-preventable diseases. Representative John Zerwas, a TMA physician member, is sponsoring the companion bill. Next, the Texas House will consider all of those bills. So just what impact did the state's 2011 budget cuts on family planning have on patients and pregnancy rates? The last legislature cut the Department of State Health Services program by 2/3, or $73 million. Nearly 147,000 patients lost family planning care as a result. Representative Sarah Davis filed House Bill 722, which calls for the Health and Human Services Commission to study the cut's impact. TMA physician leader and Texas Women's Healthcare Coalition Chair Dr. Janet Realini testified in support of the bill. She says any unplanned pregnancy can be very costly in the long run.
Unplanned pregnancy, in contrast to pregnancies that are planned for and timed at a good time, are much more likely to be unhealthy for mom, for baby, even for dad. So we're going to have higher medical costs in terms of the Medicaid bills for that. But also those children are on average going to be less healthy, less able to be ready for school when they get to kindergarten. So those costs, those educational and societal costs, are huge.
The big story is the budget. The Senate Finance Committee unanimously passed Senate Bill 1 this week, its version of the 2014-2015 budget. Here with the details on how it affects health care are TMA's Steve Levine and Darren Whitehurst.
Well, the budget bill is the one piece of legislation that everybody watches during the session, and we mark its passage through the legislative process by a series of milestones. We reached one of those milestones this week when the Senate Finance Committee approved its version of the budget. Darren, what's the big picture?
Well, the big picture is, I think the Senate came up with at least a good game strategy for a budget bill moving forward. And I think you see that in the fact that it got voted out 15-0. So you had bipartisan support from both the Republican members on the Senate Finance Committee and the Democratic members, so that they think that's a good step in the process. And it does restore some of the cuts that were made last session.
And those cuts were to programs that healthcare was very concerned about, that medicine was very concerned about. Where are we on GME, mental health, women's health?
Well, all three of those had additional funds that were put in. Again, is that part of the process. Don't want to spend a whole lot of time on the specifics of the number, but all three of those areas saw significant increases in funding. And I think at the end of the day, expecting some similar things on the House side, and I'm hopeful that we'll be able to craft something at the end of the day that's really good for those three programs and for other programs in the state. Speaking
of other programs, two big areas we're looking at are Medicaid payment rates for physicians and reversal of the cuts on the dual eligible payments. Anything on that in the Senate bill?
Well, there is not anything on that, and certainly that is something that is an area of concern. I think that when the legislature adopted the supplemental appropriations bill and put about $4.5 billion in Medicaid payments for the last 5 months of Medicaid, I think that took some of the wind out of the sails of some of the other things in Medicaid that would be talking about increasing funding. So we're going to continue to work in those areas, and I think that hopefully we'll get some support from the Commission showing that if we don't make some of these changes, getting physicians to participate in the Medicaid program is going to be difficult.
So where do we go from here? What's the next milestone?
Well, the next milestone is the Senate will hear the bill on the Senate floor. Should occur sometime during the middle of next week, and then the bill will get out of the Senate and move over to the House. The House has also been working on its budget. We'll substitute the Senate bill, go to the House floor, and then we'll go to conference committee. So we still have a long way to go in the process, but I think it's a good first step, getting a good basis out on the Senate side.
All right, thank you, Darren.
Okay, thanks.
We will keep you posted on the budget bill's progress. That's it for now. I'm Brent Anier for TMA. Thanks for watching, and please join us again next week for TMA's Legislative Hotline. See you then.